Okay, so students, we are very privileged to have Dr. Marlene Wasserman here with us today via a Zoom interview. I must just tell you before I allow her to introduce herself that she taught me as well as a student back in the day. I have a very vivid memory of pink cowboy boots. I don't know if I've made that up or whether you actually used to own a pair of pink cowboy boots.
What should I just kind of prove something to you right now?
Let's see.
Show you that it's possible, because this is what I'm wearing right now, which I think, whoa, can everyone see?
Oh, your yellow Doc Martens. Fantastic.
Right.
Okay, so I no longer believe I manufactured the pink cowboy boots. Just tilt your screen a little bit more. I can't see your face properly. There we go, that's better.
Yeah.
So as a result of our session with you when I was in 5th year at that stage, I ended up in adult world with my then boyfriend because your parting words to us were, go out there and be the best sexual being you can be. And I took that as a direct challenge. And so I dragged my ex-boyfriend and a good friend, and we went to Adult World to go and see what this whole thing was about. And I think the two of them were mortified, but it was such great fun. So that has obviously stuck with me forever. And then when I took over here, I saw that you were still teaching now the 3rd year class. So I think the students are getting some idea of what your line of work is, but perhaps you can tell us more formally what you do and what you represent.
Yeah. Okay, so my work has changed significantly over the years, as one would hope that all of our work changes as we adapt to cultural, socioeconomic changes and our own personal passions and purposes that we have in life. So I started out back in the day, I actually started out with a social work honors degree and then did a master's in family therapy. And when I was doing family therapy, I realized that children were really problematic because parents were really the problem. Children were symptomatic and parents are problematic. So kind of kicked the kids out the therapy room and started only doing couple work. And this was in just before 94 in South Africa. And at that time, there was no training in not only in couple work, but definitely not sex therapy. And as I was talking to couples, they started talking to me about their sexuality, and clearly I had no training in that whatsoever. So in 94, I embarked on my overseas training, and I spent a lot of time being certified first as a couple and sex therapist through an organization called ASECT, which is American Association of Sex Educators, Counselors, and Therapists. Today, I'm actually sit in one of their committees as a member. And I then did my doctorate in San Francisco, the Institute of Advanced Study in Human Sexuality. So I commuted for about 2.5 years up and down. Since then, I also trained in sexual medicine as a sexual medicine consultant and have maintained that association with all my sexual medicine organizations. I was a temporary advisor to the World Health Organization as well. We did a magnificent piece of work, which is really what I teach the students a lot about, Siobhan, is looking at sexual health and sexual rights. And so we brought out a magnificent book for doctors around how to do brief sexuality communication with their patients around sexuality. And that's the essence of the work that I currently have done for 20 odd years with the students, is getting them to move into integrating sexual health and sexual rights of their patients into a regular sexual history taking. And that's kind of a skill and an art, which is what we'll talk a little bit more about. Since then, I have moved away from sexual medicine in my clinical practice because you either kind of had to reach a point where you just specialized in sexual medicine. And I find that I didn't really enjoy that because it was medicalizing and pathologizing people. And I found that because of my own systemic training, I was much more interested in the biopsychosocial model, which I know that is taught at UCT as well. Much more interested in looking at all the different dimensions and variables that impact on sexuality and on the sexual health of people. And so from there, I kind of moved away from pure sexual medicine and moved into really trying to be understanding of the complexity of the environment and specifically of the relationship structures on people. And from that, I then got into research into cyber infidelity because the whole world of internet exploded, and I became very interested in what people were doing online from a technological point of view. And from that, realized that I didn't have enough skills to actually deal with cyber infidelity as a PTSD, post-traumatic stress disorder, and became very interested in trauma. This was about 5 years ago. And since then, I'm actually now full on into becoming a certified trauma practitioner. So all of my work is trauma informed now. And so the way that I work with sexuality and with sexual health and with relationships is through a trauma informed lens. And it's very important for us to be aware of this in South Africa, because there are two levels to it. The first is that we suffer from collective trauma as a country, as a globe, but certainly as a country, because that's my interest. And then in a microcosmic way, we suffer from trauma in our lives. Now, my interest in trauma has a deep impact on health. And I'm going to tell you why. You know about public health, so you will understand this. Has a deep impact. So the two kinds of traumas that exist are PTSD, which would be a once-off event, like a rape or a car accident, or a sudden illness or a sudden surgery, where there's an event that kind of causes an internal shattering and then people kind of get on with it. But what is much more important, and the thing that I really want the students to be aware of, even though they're not going to directly be dealing with it, is that childhood developmental trauma has a massive interest in impact in causing illnesses in adults. So the illnesses start kind of from the top of your head, go all the way down. And mostly what the illnesses are inflammatory diseases. And I'm sure that all the students can understand because they know, and I'll talk through the different systems that impact on sexuality and sexual health, but one of the biggest ones is endocrinology. So we know that hormones deeply impact on people's sexual health. We know also that trauma creates the releasing of stress hormones into the body. And if you start getting a releasing of those stress hormones from a very young age, by the time that you are a teenager, by the time that you're an adult, you know, you're definitely going to have a disease. So because I work so much with teaching students about the importance of a good diagnosis, I want them to really bear in mind this as another piece of their history taking, that when they see a patient who is not presenting, well, one of the sexual health problems that definitely is directly related to childhood trauma would be something like endometriosis. So would be something like IBS, would be something like inflammation in the gut, anxiety, depression, suicidality, drug addiction. I was going to say sex addiction. There isn't sex addiction, but risky sexual behavior. We know that these alcoholism, cutting, all of these are as a direct result of early childhood trauma. So I say again, because they get really anxious, you know, medical students get really anxious if you kind of move out the paradigm of medicine. So you don't have to treat that. It's not that I'm saying you have to treat it. It's just something I want you to be aware of. And you don't ask it even, just note it, so that when you're busy with your diagnosis, you don't just give a pill, but you refer to somebody to be able to deal with the cause of that symptom, the cause of that disease. Why has this person got ongoing yeast infections, for example? What is it? It's not that this is something bad. It's because there is too many stress hormones. There is a distress in the body that is over a period of time that has caused these symptoms to be there. I just want them to have an awareness that this is another piece that is part of it. And in fact, if you look at what the definition is of sexual medicine, that is the one big piece that's part of the diagnosis is trauma. So we really want them to be aware that the illnesses that they're looking at may very well be as a direct result of childhood trauma that exists.
Absolutely, agreed. Thank you. That's very illuminating. I'm just going to pause the video so that we can go on to the next little chunk.